Hi, this is Dr. Jovita Martin Daniel. I'm a medical oncologist at Chennai, India. I'm here to talk a few words on the do's and the don'ts for patients who are on chemotherapy and chemoradiation. The general measures that we all recommend are that the patients should wear their masks wherever they go to a crowded place, and even if they attend a follow-up clinic or an outpatient clinic in the hospital. And they should avoid hand shaking. They should avoid contact with any sick people at home or outside. They should not delay or skip any of the chemo cycles or follow-up dates as much as possible. And we advise them to be remaining motivated so that they don't skip on their regular checks. We advise them to not to confine to bed and be active most of the times. This will actually help them not to have any stasis of the blood in the veins, in the lower limbs especially, because malignancy itself is a hypercoagulable state, so it tends to form a lot of clots in the veins. Therefore, we advise them to be mobile most of the times. We advise them not to shave or tonsure their hair, or we advise them not to go in for any invasive procedures, especially during chemotherapy when their counts actually dip down. When I say counts dipping down, it means that the WBCs actually decrease, gets compromised, and thereby they are prone to get a lot of infections. And they should avoid using public toilets or toilets which are not clean, and even in their own respective houses, if they have other people staying and using, I think they should be very careful about the Western toilets, especially women who have short urethra and those who have diabetes and who are immunocompromised because of chemotherapy. They got to be very careful so that the urinary tract infections are avoided. And we advise them generally not to smoke or drink or use tobacco, and general warning signs for them to report to a health professional or an oncologist immediately when or if they have a fever more than 100 degrees Fahrenheit right after chemotherapy, extreme tiredness, loose stools more than 4 times or vomiting more than 4 times, or any other bleeding episode. In those cases, the patient should immediately, without any delay, approach a health professional. And there are often asked questions about the medications that they previously have been taking, especially if they are a diabetic or a hypertensive or a person who has a coronary artery disease. So these patients would come and ask us, "Doctor, should I continue these drugs while I'm on chemotherapy?" And the answer is a definitive yes. Whenever we have other comorbid conditions, they have to have their medications continued through the chemotherapy and even after that. In fact, we advise a recheck or a revisit to the physicians who've seen them previously, example a cardiologist or a diabetologist, in order to make sure that their level of medications are correct, and if required, a de-escalation or an escalation is done in their medications so that there's no complications while on chemotherapy, and chemotherapy schedules go on seamlessly. And a few words on diet. These are very commonly asked, and it's imperative that we know these points. First is keeping a person hydrated. We all know hydration is very important, and to be well hydrated, just like any other person, 2 to 3 liters of water is essential. But in a case of a patient on chemotherapy, when they are not in a position to have a lot of water, we would definitely recommend that at least cumulatively, putting all the liquid intake together, like the soups, the juices, and all other water together, it should be definitely at least 2 to 3 liters. And we see that the food should be well cooked and freshly prepared at home with low salt, low oil, and low spices. We have to avoid spicy food and salty food because it can cause heartburn, and more of vegetables, fruits, nuts, and eggs could be incorporated in the diet. Most of the times these patients find it very difficult to eat. They don't have a good taste. They have dysgeusia, altered taste, altered smell, so they find it very repulsive to eat, and they don't find the energy to eat. Chewing becomes difficult. In those cases, we recommend that the patient takes small, frequent foods about 5 to 8 times a day. And while preparing the food, we make sure that we teach them how to wash the fruits and the vegetables before cooking the vegetables, and thin-walled fruits like the apples, grapes, and figs, and so on, with lukewarm water. We could add lemon or vinegar or salt or turmeric, wash them thoroughly, and wipe them with a clean towel. If it is going to be thick-walled fruits like the pomegranate, pineapple, and bananas, they are safe to eat. But the knives that we use to cut the vegetables and fruits need to be extremely clean, and the mixies, the grinders, the grinder jars, the mortars should be kept clean, and it should be washed after every use. In the South Indian use a lot of ammi and article, those should be also very cleanly used. A lot of people take tender coconuts and they used a big knife, which is called in Tamil arval. Sometimes when they get it cut from outsiders, it's not hygienic, so they got to make it very clean and make sure that they cut it at home. And the raw food or the uncooked food should be avoided. Any leftover food should be immediately positioned, displaced within the fridge and stored within the fridge in a timely fashion. And if they're going to take the food and use it from the fridge, they got to reheat it in the micro oven or in the stove, and make sure that it is well preserved and given. And cold meats, sausages, sushis, unpasteurized milk should be definitely avoided, because this could be a source of several infections like salmonella. And runny eggs, which is undercooked like a bullseye, that is also a little dangerous. Taking a bit of more of caffeine, or one a day, a small quantity is no issue, but caffeine in excess, especially when the patient is on chemotherapy, needs to be curtailed, because that also causes heartburn and also loss of sleep because of anxiety. Unwashed veggies, raw nuts, raw honey should be avoided. Blue cheese is known to have cultures with microorganisms such as penicillium and brevibacterium, so blue cheese should be avoided. Patients on chemotherapy, as I already said, or have altered taste and decreased appetite, so we have to not only frequent the meals but also give it in such edible forms that they are able to easily take it, because most of the times they're not able to chew easily. So when it comes to proteinaceous food, especially with vegetarians, like the legumes, the lentils, the pulses, they're not able to chew it. So we have to make sure that we could actually boil them well in the cooker and make a puree out of them and give it as a soup or give it as a smoothie. And we could also use boiled vegetables and nuts in excess in the smoothies and the soups that we use, and also in the salads. And I recommend them to have a lot of garlic, cumin, sesame seeds, These will help them, and also turmeric, and this will help them in an antioxidant manner. Um, Non-vegetarians can consume mutton, chicken, fish when it is well cooked, steamed, or baked at home. Eggs are a very good rich source of protein, so definitely egg in well cooked forms like boiled eggs or scrambled is an ideal way of taking eggs. Sometimes 3 to 6 or even more depending upon the requirement. And we could have special diets for some of the comorbid conditions, such as if we have a diabetic patient, we got to help them adhere to the diabetic diet, which is really very difficult. It's pretty challenging because taste is something which is important, and when there is a compromised taste, the diabetic patients find it very difficult. So the main thing in this is that they have to cut down on the rice, the white rice, and replace it with the black rice, the brown rice, and then a lot of other ragi, bajra, millets, oats, maize, jawar, and so on. So these can be very good other replacements apart from rice. So they could they could actually make their own menu, and this can get their sugars under control. And hypertensives and renal disease patients, they could follow their low salt intake. And heart disease, those patients with cancer should have low cholesterol, low oil and low greasy foods, so that that doesn't impair their cardiac health. And those patients who are on chemotherapy as well as on targeted therapies should curtail on their berries intake, like the grapefruit, clementine, and several orange types, and also strawberries, raspberries, and blueberries, because the resveratrol, which is present in the berries, actually counter the chemotherapeutic effect. And also we see that the citrus fruits, which is rich in flavonoids and hesperidin, that also reduces the effect of chemotherapy. Therefore, I think that these are the only fruits which could be restricted. Apart from that, I think for diabetic patients, guavas, pineapples, papayas, figs, avocados, a lot of nuts can be very, very good fruits that they could have without any issue of impaired glycemic control. I hope these points are have really enriched your understanding on how exactly to go about the care that needs to be given for patients who are on chemotherapy. Hope to see you in another video.